Hello, I'm Dr. Sarah Williams here in the UK. Today, we're discussing a surprising factor that quietly affects your health every single night. Many people think sleep is just rest, but research shows the way you lie down could be quietly aging your heart, brain, and joints without you even realising it. In fact, certain positions can increase your risk of stroke, memory problems, and chronic pain by more than 60%. And over the next few minutes, I'll guide you through the worst sleeping positions for seniors and the safest ones that can restore your energy, improve memory.
Did you know that how you sleep tonight could be quietly accelerating the aging process in your body, affecting your heart, your brain, and even your ability to remain independent? It may sound surprising, but recent research from the National Institute on Aging shows that certain sleeping positions can raise the risk of stroke, memory decline, and chronic pain by more than 60%. What's rarely discussed is this: most seniors are doing this every night without realizing it. For many older adults, sleep becomes more challenging with age. There's tossing and turning, waking up stiff, sore, or still tired. But what if the real issue isn't how many hours you sleep, but how you sleep? Researchers now say your sleep position can either support healing or slowly wear your body down. It can reduce joint strain, protect the spine, and improve circulation, or it can do exactly the opposite. Tonight, we're taking a closer look at the truth. We'll cover the 4 worst sleeping positions to avoid after 60, followed by 4 healthier options that can restore energy, support memory, and help you wake up feeling noticeably younger. Stay with me, because what you're about to learn could permanently change the way you sleep. Before we begin, if you haven't subscribed yet, I encourage you to do so and turn on notifications so you don't miss future health tips created especially for you. If you enjoy this video, type 1 in the comments. If not, type 0 and let me know how we can improve. 1. Sleeping on your stomach, the face-down position. At first, sleeping face down can feel soothing. Arms under the pillow, drifting off as if nothing can disturb you. Many seniors like Harold, a 72-year-old retired carpenter from Ohio, say it's the only way they can fall asleep. "It feels like my back finally relaxes," he once told his doctor. What Harold didn't realize was that this position was slowly harming his neck, spine, and breathing night after night. For seniors, stomach sleeping places constant strain on some of the body's most vulnerable areas. Turning the head to one side for hours forces the neck into an unnatural twist, restricting blood flow to the brain and compressing delicate spinal nerves. Over time, this can lead to persistent stiffness, headaches, dizziness, and tingling in the arms or hands upon waking. The American Chiropractic Association warns that this position increases the risk of cervical misalignment, which can affect balance and coordination, especially dangerous for older adults. Breathing is also affected. Pressing the chest into the mattress limits lung expansion, forcing shallow breathing throughout the night. For those over 60, this means less oxygen reaching the heart and brain, worsening fatigue, mental fog, and even blood pressure. Added pressure on the lower back can further aggravate arthritis or disc problems. Geriatric sleep specialist Dr. Emily Rhodes calls stomach sleeping the most aging position for the spine, explaining that it accelerates wear on the vertebrae much like bending the same branch until it finally breaks. While it may feel comfortable in the moment, stomach sleeping slowly steals comfort and mobility over time. But what about curling up on your side? It feels natural and familiar, yet it also carries hidden risks. 2. Sleeping in a tight fetal position. This position often feels instinctive and safe. Many seniors curl tightly at night, knees pulled to the chest, arms tucked close. Eleanor, a 68-year-old grandmother from Michigan, slept this way her entire life. "It feels like I'm protecting myself," she said. But years of waking up breathless, stiff, and exhausted led her doctor to an unexpected conclusion. Her sleep position was quietly restricting her body every night. According to the National Sleep Foundation, pulling the knees too close compresses the diaphragm, limiting lung expansion. This reduces oxygen intake and forces shallow breathing. For aging lungs that are already less elastic, even small drops in oxygen can cause chronic fatigue, morning headaches, and added strain on the heart. Spinal health also suffers. Curling tightly places the spine in an exaggerated C shape, shortening the muscles that support posture. Over time, this can worsen spinal curvature, increase instability, and raise the risk of falls. Spine specialist Dr. Leonard Hayes explains, for seniors, sleeping too curled up is like training the body to shrink overnight. Eleanor's experience is common. What begins as comfort can gradually reduce strength, breath, and posture. The fetal curl may feel secure, but for aging bodies, it often becomes a trap. So if curling is harmful, what about lying flat on your back, the position once recommended by doctors? 3. Flat on your back with no support, the soldier position. For years, sleeping flat on the back was considered ideal, straight spine, even weight distribution. But for seniors, this position can quietly become dangerous. Robert, a 74-year-old veteran from Florida, slept this way his entire life. Over time, his wife noticed long pauses in his breathing, loud gasps, and constant morning exhaustion. A sleep study revealed severe obstructive sleep apnea. His sleeping position was allowing his airway to collapse dozens of times per hour. When seniors lie flat without proper support, gravity causes the tongue and soft tissues to fall backward, narrowing the airway. This leads to snoring and interrupted breathing, often without awareness. The American Academy of Sleep Medicine reports that untreated sleep apnea in adults over 60 increases the risk of stroke, heart attack, and memory loss by more than 60%. Lying flat also worsens acid reflux, which affects nearly half of adults over 65. With the head level to the stomach, acid can rise into the throat, disrupting sleep and damaging the esophagus and lungs over time. Robert's health had already suffered before changes were made. His story reminds us that stillness does not always mean safety. And what about sleeping in a recliner, something many seniors rely on? 4. Sleeping in a recliner every night. For many seniors, the recliner starts as a place to rest sore joints or watch television. When bed discomfort increases, it can slowly become a permanent sleeping spot. But despite how comfortable it feels, nightly recliner.
Sleeping can be harmful.
Dorothy, a 79-year-old widow from Arizona, slept in her recliner for years due to hip pain. Over time, her legs began to swell, her back stiffened, and her energy declined. Her chair was quietly working against her health. Dr. Michael Turner, a geriatric rehabilitation specialist, explains that recliner sleeping restricts blood flow to the legs, causing fluid buildup, swollen ankles, and in serious cases, deep vein thrombosis, dangerous blood clots that can travel to the lungs. The semi-sitting position also prevents full spinal relaxation, leading to chronic back tension and muscle weakening. Over time, balance declines and fall risk increases. Because recliners limit deep sleep stages, the body never fully restores itself. Even after many hours of rest, Dorothy eventually returned to bed. After being warned that prolonged recliner sleeping could shorten her lifespan, "I thought I was resting," she said, "but I was slowly shutting down." So where should seniors sleep? That brings us to the healthier alternatives. 1. Side sleeping with a pillow between the knees. This simple adjustment can dramatically improve sleep quality. Side sleeping with a pillow between the knees helps align the spine, reduce joint pressure, and improve circulation. Alan, a 71-year-old retired firefighter, struggled with chronic hip and back pain. His physical therapist suggested adding a small pillow between his knees and adjusting his head for alignment. Within weeks, his pain was cut nearly in half. Research from the Cleveland Clinic shows that side sleeping, especially on the left side, improves heart circulation and reduces acid reflux. The knee pillow keeps the pelvis balanced, reducing spinal strain and morning stiffness. It also helps keep airways open for those with sleep apnea. Doctors often call this position the alignment saver. But if side sleeping isn't comfortable for you, there's another option. 2. Elevated back sleeping. Head and knees slightly raised, with gentle elevation, back sleeping can become highly therapeutic. Raising the head about 30 degrees and placing a pillow under the knees reduces reflux, improves breathing, and relaxes the lower back. Linda, a 73-year-old retired teacher, struggled with heartburn and nighttime breathing issues. After elevating her upper body and knees, she noticed immediate improvement. According to the American Academy of Sleep Medicine, this position reduces snoring and sleep apnea episodes while protecting the heart and brain from oxygen drops. But there's another back position that offers even more freedom. 3. The Starfish position, back sleeping with arms relaxed outward. The Starfish position allows the chest to open and joints to release tension. Arms rest comfortably at the sides with palms up, while the head is supported. Linda, a retired nurse, found that this position relieved years of neck and shoulder pain. Harvard Medical School notes that this posture improves blood flow, reduces nerve compression, and helps prevent numbness and tension headaches. Still, some seniors need extra support, which leads us to the final and most balanced option. 4. The 45-degree side recline. This position combines side sleeping with gentle elevation. Supported at a 45-degree angle with pillows or a wedge, it reduces reflux, keeps airways open, and maintains spinal alignment. Walter, a 78-year-old former truck driver, experienced immediate relief using this setup. Research shows it can reduce acid reflux by up to 70%, improve deep sleep, and support brain health through better lymphatic drainage. Dr. Renee Collins reminds patients, sleep isn't just rest, it's recovery.